Hi, I'm still students. Welcome back to my channel. Today's topic is about diverticulitis, and the significance of knowing diverticulitis is to prevent abnormal or irregular bowel behaviors that trigger later on chronic diseases. And this topic enables us to have preventative cares with prompt intervention. So, according to Sid Winston Hospital, reported that diverticulitis commonly happen to elderly people aged 85 years old and above, and these incidents keep increasing with age factor, and about one-third of Australians over 45 years and two-thirds of Australians over 85 years have diverticulitis disease during their lifetime. And so the question is, why diverticulitis mostly occur to elderly people? Because of their age, or because of their immune system, or because of something else? So let's find out. So the aim of this presentation is to understand the definition of diverticulitis, the etiology, the symptoms, the risk factors, pathophysiology, the diagnosis, the treatments, and preventative cares. So what is the definition of diverticulitis? So diverticulitis is a wide spectrum disease, develops bleeding and inflammation by abnormal formation of sac-like small pockets. So in this case, it's like a sac-like small pouches inside the mucus of the gastrointestinal tract and digestive tract, and commonly inside the sigmoid colon of the light intestine. So that means there are pouch formation inside the colon, and it causes inflammation and bleeding. So what is the etiology of diverticulitis? The etiology of diverticulitis occurred due to insufficient dietary fiber consumption that generate nutrient blockage and solidify or hardening those nutrient form, like hardening the stool, and delay consequence of bowel motion. So then it causes bowel obstructions, and it triggers hypertrophy, colonic muscle constriction, influences the mucosa's inflammation and infection. Then it's into diverticulitis. Um, Diverticulosis or diverticular disease. Dietary fiber deficiency, which means low diet fiber, um, that cause hypernatremia, so low sodium level, and result into dehydration and then diarrhea. Fiber food lower the intracolonic pressure. So the cause of diverticulitis is when the intracolonic pressure is low because there's no fiber food to push down the stool. That means increasing transit time. So it's obstruct into your colon, and the stool weight are also heavy, and the volume to increase the bowel frequency. In this case, diverticula commonly occur in the Western population, and Industrial Revolution confirmed that the sugar and the white flour consumption is coincided with dietary fiber deficiency. Like example, like bread that is made of flour, but when it's getting hot solid to digest, it can cause diverticulitis. So what is the difference between diverticulosis and diverticulitis? So the word diverticulitis redefines by the inflammation and infection of small pouches formation due to bowel obstruction infected by bacterial overgrowth inside the colon. Diverticulitis develop bleeding, abscess, fistula, peritonitis, and stenosis as well. And diverticulitis develops signs of infection like swelling, redness, and pain, abdominal pain, usually in the left lower quadrant of abdomen, and it can lead to diverticular protrusions when the colon walls leak, and those when the bacteria colonize inside visceral organs. And people tend to have bad breath as well. Diverticulitis heals quicker with antibiotic than diverticulosis. So the word diverticulosis refers to a symptomatic formation of small pouches inside the colon's mucosae, causing herniations, herns, like all the colonic muscles, and affect the medulla weakest point of the colon and become inflamed. So diverticulosis, there's no symptoms show at all. You can't know it. You can't spot any symptoms, but it's just happened inside the bowel. But then diverticulitis, it can cause signs of low pain, like in the left lower quadrant of abdomen. And diverticulosis is also the same, similar to diverticulitis, is low fiber diet, physical inactivity, or medication side effect, and dehydration that can trigger these disease. And diverticulitis occur when a diverticular outpouching becomes inflamed or when infection occur. When diverticulosis, it affects the entire colon and the rectum, did not, but it's complete muscular wall, and it did not form diverticula. So the presence of the symptom, typically left-sided abdominal pain and change in bowel habits in the absence of acute inflammation in terms of diverticular disease. So let's understand the symptoms of diverticulitis. The symptoms of diverticulitis can be asymptomatic or vague, which means there's no showing. It's like silently happen. And it includes abdominal pain in the left lower quadrant due to hypertrophic colonic muscle constriction. That's when intracolonic pressures reduce. Muscles cramping, diarrhea, constipation, distension, inflammatory response like fever, tenderness in the lower left quadrant of abdomen. That's when the leukocytosis increase the white blood cells, hemorrhages, peritonitis, bowel obstruction, and fistula formation. So these are the symptoms of diverticulitis. Let's get to know what are the risk factors. The risk factors of diverticulitis includes unhealthy diet with hard solid foods, lack of fiber foods, prolonged dehydration, medication side effects, prolonged physical inactivity, prolonged holding or bowel movement, irregular bowel patterns, smoking and alcohol, age factor, and prolonged sitting posture. So what is the pathophysiology of diverticular? Diverticulitis pathophysiology develops when low fiber diet consumptions influence the intraluminal pressure of the colon's tissues to increase contraction and hypertrophy. That's when the artery penetrates tunica muscularis, result in inflammation and prolonged bleeding with waste nutrient triggered by infections. In a simple way, it's when there's no fiber food in your diet when you consume and then you digest it, those hard solid food, and then the colon tissues, it that's not resistant or it has like low ability to contract, so it keep increasing the contraction pressure. So then the arteries, the blood vessels, it penetrate the muscular permeability, and then it result into inflammation response. So those inflammation then result into bleeding and into the stool inside the colon, and then those when it's bleeding, when it's inflammation at the colon wall, the stool, usually the food that we already digest, it has bacteria. It has some sort of bacteria in the stool, in the bowel. So then those bacteria infected, it goes into our blood inside the colon. So then it's infected us. So we call it bowel infection, and then trigger into diverticulitis. And some case, the colon, when its inflammation is triggered so hard, and so the colon wall becomes thinner and thinner, it can cause protrusion, which means it's leak. It's leak into outside the colon. It's outside the large intestine into everywhere in the digestive system and the body organ. So what are the diagnoses of diverticulitis? The diagnoses include radiology and pathology. Radiology includes CT scan. Abdomen CT scan reveal a perforated duodenum, like a small intestine with peritoneal free air and surrounding fluid accumulation. So indicated that a perforated duodenal ulcer complicated by diverticulitis. So CT scan can capture those. And then we have blood tests. Again, blood tests to check the white blood cell count, ensure that some white blood cell count it will indicate infection or inflammation or low sodium level. And full blood test count are also important to observe any bleeding, to check hemoglobin. If it's low bleeding, if it's high white blood cell, it means it's infection. And C-reactive protein to observe inflammation level by scale. And again, ESR, like the erythrocyte um, scales, also check the infection level and chronic inflammation, like how the intensity of the inflammation. And the UEC indicate low sodium or renal impairment to check the kidney. And then we also have colonoscopy, and then X-ray. In this case, X-ray is more affordable than CT scan. Also, we have the national bowel screening criteria in Australia. So people tend to have bowel cancer sent to their post or mail to check their stool and then send back to the post to observe the result of bowel. And usually like 5 years, every 5 years. So this is called national bowel screening criteria. And also part of the diagnosis for diverticulitis. And so what is the treatment of diverticulitis? The treatments include medication and surgery. Maybe there are other therapy, but medication and surgery are the common treatments options. Medication include here, we have administration of fluid. So in this case, there's patient have diarrhea, blood loss, water loss, dehydration. So fluid administration. Then antibiotic, like when there's like protrusions of colon mucosa or maybe bile infection to the blood, that's when we need antibiotic to decrease the infection. And analgesic for pain. Usually people might have abdominal pain. And some people also have nausea or vomiting. That's rare side effect or rare symptoms that can cause. So antiemetic medication also help. And surgery options include ileotomy. It's an urgent surgery procedure. Remove the small intestine, the ileum part. and laparotomy to explore and repair the perforated duodenum, the small intestine, and the debridement of infected tissues. And colostomy is when the diverticulitis becomes severe, it's become chronic and complication. So that's when we need colostomy to allow the bowel to rest and heal. Um, Again, that could not adequately repair without any recovery. So fluid drainage via cannula using stoma will be done after the surgery. So patient expect to have stoma as well. And again, stoma created in the lower abdomen area to insert colon back into the stomach, back into the abdomen, and for urination and bowel movement. It must be clean, dry, and tidy for the stoma. And sigmoidoscopy, it's like surgery that sigmoidocolectomy. Sorry, this part is sigmoidocolectomy. So to remove the sigmoid colon. So what are the preventative cares? The prevention for diverticulitis is simply based on the diet. So encourage small, easily digestible diet, like gradual introduce of enteral nutrition as tolerated, and starting with a clear fluid, small foods, and then go to advanced. Commonly consume meals with fiber food, and the daily intake should be 30 grams of fiber to prevent constipation. This is according to the St. Vincent Hospital. And encouraging hydration with sufficient water intake of 8 cups per day following regular exercise to improve bowel movement. Not just 8 cups, you can go more than that. And avoid heavy physical activity. Again, regular physical exercise can be done, but don't over work out that can cause pain to the abdomen activity. And these are all the preventative care, stay hydrations, and eat fiber food for easy digestion and bowel movement. And references available upon request. And thank you for watching. If you like this video, like, subscribe to my channel, and see you in the next one. Bye.